a group of healthcare providers and patients are in Ottawa advocating for regulatory change around access to psilocybin. That's the active ingredient in magic mushrooms. The group says it has requested a meeting with the federal health ministers for over 400 straight days. Their request has been denied. Joining me now is the president and CEO of TheraPsil, Spencer Hawkswell. Spencer, thanks for taking the time. Can you start by telling us about your organization and what you're advocating for?
Absolutely. The organization TheraPsil is a nonprofit healthcare coalition with a membership comprised of patients and healthcare practitioners that are looking for access to medical psilocybin for psilocybin-assisted psychotherapy. A majority, probably around 80 to 90% of the patients are looking for access to psilocybin to treat end-of-life distress and treatment-resistant depression. And a number of healthcare practitioners are also looking for access to use it in training so that they can treat these patients. Now, a lot of these patients are looking for access because they're treatment resistant, meaning they have tried every single treatment possible to try and combat their end-of-life distress. Now, fortunately, psilocybin, the active ingredient in magic mushrooms, has shown very promising results in a number of clinical studies that have shown it effective in remedying this end-of-life distress, so, which is really anxiety, depression around the end-of-life diagnosis and treatment-resistant depression. And so, you know, these patients have access to medical assistance in dying. More patients with only a mental illness will have access to medical assistance in dying come March. But the problem is they wouldn't have tried every available treatment, such as psilocybin, because the government's withholding it from them. So these people are here in Ottawa today, making sure that they're not denied a right to try psilocybin before they're given the right to die.
Yeah, because I don't know whether many Canadians know about that, but as you say, medical assistance in dying is really going to open up in the next few months unless there's some kind of legislative change. So as you say, there are psilocybin access, while right now Canadians can legally get psilocybin through special access programs, but I think what you're implying is that it's just not enough?
It's nowhere near enough, and you're right, there's the special access program, but it's really more like the slow access program. We've had about 2,000 patients on a wait list for the last 2 years trying to access psilocybin through this program, and it's been a complete failure, a changing goalpost. We've had Health Canada shut down doctors who have been using it successfully because they've treated too many patients. And we've had the officials also tell patients that they have to try obscure treatments like electroconvulsive therapy first before they're able to access psilocybin. So it's just been roadblocks and red tapes for these patients.
So what kind of response have you had from the federal health minister when you kind of put it like you did just now, when you say, look, medical assistance in dying is likely going to open up to people who are facing clinical depression, and yet psilocybin, or the active ingredient in magic mushrooms, is not going to be widely available to those who've tried everything?
So in 2020, under the leadership of Patty Hajdu, the health minister, we got exemptions through what's called Section 56. And that's where the Minister of Health personally signs exemptions. And that Minister Hajdu was very compassionate and courageous. However, the new health ministers, Jean-Yves Duclos and Carolyn Bennett, have completely ignored patients, as you had stated in my introduction, for over 420 days. And, coming to Ottawa, the reason I'm here is we brought those patients to the minister's offices outside of Parliament, and we were protesting, and the minister still would not come out. They seem to be completely ignoring the issue.
All right. So what are you going to? Why do you think that is? Just very quickly.
It's difficult to say. It really is difficult to say. It's tough for ministers to make big decisions for this government that is largely operating a bit like a PR firm and trying to avoid crises. It's difficult to say. I think that they're just worried about how the Canadian public might perceive this. And as far as we can tell in the studies we've conducted, 80% of Canadians seem to support this. I mean, there's magic mushroom dispensaries open across the country, a couple here in Ottawa where they're being sold outside. But so Canadians seem okay with it, but the Minister of Health is not.
Spencer, thank you. Spencer Hawkswell is the president and CEO of TheraPsil. We reached him in Ottawa.